Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello there. Welcome to another episode of the Unreal Results podcast. I'm in a hotel room. Clearly, maybe not clearly. Maybe you think this is my bedroom looks like. I don't know. But I'm in a hotel room in Vancouver, British Columbia. Technically in Richmond, British Columbia, which is south of Vancouver. And I'm here for a course. I took a course this weekend. I took a Barral Institute course. I took visceral vascular manipulation of the lower body. And the lower body is not just the lower extremity, but like the lower body. So we covered all the vascular structures from the abdominal aorta at the level of the celiac trunk down all the way to the popliteal artery. So learned a ton of amazing techniques specific to the vascular structures, and I loved this class. And I already know I'm going to use these techniques a lot in my practice. They are really gentle, and they are even though they're very gentle, they're very profound in their effects and support of all the structures that they provide blood flow to. And so I really felt it in my own body. Shout out, I had a great partner, which in these courses can make all the difference between a good experience and a bad experience, both learning the material and also physically what happens in your body as the patient on the table. My friend, Susanna Reed, she's a physiotherapist in British Columbia in South Surrey area, so the Vancouver area as well. And I've known her for a couple years. Shout out Susanna. She does listen to the podcast, so she's going to hear this more than likely. But she was actually the tipping point to me deciding to come to the course this weekend. I literally signed up on Tuesday, and the course was on Friday. And I was kind of thinking about it because I had to get my CV ready for a deposition I was doing last week, and I keep my CV current with what Con Ed courses I've taken, and I noticed oh my gosh, I haven't taken a Con Ed course this year, which is rare. I had a couple scheduled at the beginning of the year, but I canceled it because I was just so focused on my athletes rehab, and so I was like, I should see if there's any courses coming up between now and the end of the year that I'm interested in taking. And this one has been on my list for a while, and they don't offer it a ton. So I was like, it's this weekend, and technically I was open. I had a business mastermind online Thursday, Friday, technically that I was going to attend, but it was being recorded, so I was like, I can watch that another time. And then I was like, well, let's look at flights. And so flights to Vancouver were surprisingly not expensive, as long as I had a layover in Seattle. Direct were expensive. And the other big thing is my favorite teacher teaching, Ron Mariotti. And I say Mariotti because of the Oregon quarterback, Marcus Mariota, but I think it's Ron Mariotti. Tomato. No, important to get people's names right. But I interchanged the two because they're very similarly spelled. Anyways, Ron was teaching. He is my favorite. And then the course I wanted, it was close. And I was like, oh, do I? And then Susanna happened to message me on Instagram, and I was like, hey, I'm thinking about going to Visceral Vascular in Vancouver this weekend. And she's like, oh my gosh, I'm going, you should come. And I was like, okay, that's it, I'm coming, because then I was like, I'll potentially have a partner that I know and trust and like, and somebody to learn with, which was really exciting. So anyways, Susanna was the final tipping point to get me here, and I'm so, so glad she did, because it was a great course. And like I said, it was super gentle but profound work. I mean, the whole visceral and neural manipulation is sort of like that. It's not so, it's like, yes, it's gentle and it is lighter touch than traditional, maybe manual therapy, but it's actually still fairly like you're on the structure. So, I had been having some digestive symptoms that have been bothering me for a while now, but they were very heightened after I got the bladder infection the beginning of September, and I have just been not feeling great in my gut. And like, I always have GERD, gastroesophageal reflux, and reflux. And with the GERD, I don't have, well, the GERD symptoms I usually get are just a lot of ear pain upon waking. And I think some of that ear eustachian tube irritation too adds to sort of some postnasal drip I get in the mornings quite a bit too. So those are sort of the main symptoms, but burping is a big one too. And it was the burping actually in the last month that had gotten like very, very much a problem. Like, I'm talking about burping all day long, all the time for no reason. Like, usually it's just like after food, but this was like literally all day long. And it was just really bloated feeling, and to the fact that like for the first time ever, I didn't even really want like any like tight pants touching, like any degree of tightness on my abdomen. And yeah, I was just really uncomfortable. And I tried some different movement. I tried, being better about not eating my foods that I know or I'm sensitive to. And I added supplements back in, and some of that helped, but not dramatically. Like, of all the supplements I added back in, molybdenum was the biggest one that helped me. And molybdenum is a mineral, and specifically important mineral that converts sulfur foods to sulfites, to sulfites. And so when your body doesn't have enough molybdenum, it's a really hard word to say. You have a hard time making that change, and so you begin to have like a sulfur sensitivity, because sulfurs are very gas producing, and I've struggled with that in the past. Interesting enough, the glycophosphate that is in genetically modified foods, glycophosphate is the chemical that's in Roundup, which is the fertilizer that they use on foods to prevent insects from killing crops. Glycophosphate blocks the receptor in your body that molybdenum would be attaching to help that conversion from sulfur to sulfite. And so that's why doing a molybdenum supplement can be helpful. So adding that back in, I hadn't needed it for years, really. Adding that back in did help a little bit. But this whole story is to say that the first day of class, we did this technique on the gastric arteries. So the left gastric artery and the greater omental artery, which is like an epigastric artery. So basically the arteries that are surrounding the stomach and influence the function of the stomach quite a bit. And taking a step back too, we like worked on the aorta first, and then the gastric artery comes off the celiac trunk. So you're working that part of the artery. Then you're working the artery around the lesser curve of the stomach, and then you're working around the greater curve of the stomach, which is actually a branch of the splenic nerve. And that no, sorry, it's not splenic artery. And then that artery actually nests the most with with the hepatic artery. And so we had worked on that too. So basically, affecting the arterial flow. And when you're working on the arteries, you're also really working on the veins too. So both the vasculature and the arteries. Basically, though, that technique made a huge difference. Like instantly, I felt a difference in the burping and the just general discomfort of my gastroesophageal sphincter area and like stomach epigastric area in general. And then that night felt good. And then I woke up Saturday morning with zero ear pain. And when I was walking to class from my hotel, I was also, not only did I have zero ear pain, but the auditory, the amount of sounds I was hearing in my ear that morning was like, wow, my ear has my ear hasn't felt this clear and not irritated in literal years. And so that was that's been a huge thing. And then the more we treated all the different arteries in the gut, the better all of my symptoms were. And like today, still woke up with no ear pain. Just in general, my digestion feels a lot better. I don't feel bloated. It's like huge. So anyways, you all already know like how big I am on improving blood flow and lymphatic flow to really like systemically the whole body. But it's so important for our organs to be able to function well to have this. And also too, I'd been having some pretty significant SI joint pain and low back pain, and that is completely better. And all the walking, my feet haven't hurt at all. So definitely like a big fluid shift as well as a big improvement of general function of my organs, more than likely from improved blood flow. So like I said, I'm really excited to take this work back to my clients. And then also like think of ways that I can share this work and, you know, give some simple like self care or like some simple ways to have a similar effect on the arteries to the guts, and appreciate where the arteries to the digestive system are, and appreciate just the anatomy of the arteries and like how you can target treatment at those areas to have a big effect. And we do talk about we do talk about this actually in the LTAP level 1 course, and then within my both the in-person course and the online course, and then just within my other like educational containers, because a lot of times when I recommend going back to the level of the spine that's going to affect the organ, some of the levels of the spine not only are neural reflex areas, but also relate to where the celiac trunk, superior mesenteric artery, or inferior mesenteric artery branch off the abdominal aorta. And oftentimes when you're working on that segment, in relationship to that, you can have an effect on the artery and the vascular flow in general. So, there's always a way that we can like take a step back and be like, how can we use our current tools to focus on and affect these similar structures, even though you might not have the specific tool in your hands to treat the vascular structures itself. There is always going to be a benefit in being able to get more specific and more precise with your treatment. But when you don't have those tools yet, you can still start to consider these pieces of anatomy and their role in whatever things that you're treating. And so, that's sort of like, I always think of like, well, what's my goal in not even my goal in like sharing the work, because that's not ultimately my goal. My goal is to see sort of like the bigger pictures and principles, and remind you all that you have many useful tools that can be more effective when you're applying them in the right spot. And the right spot, first of all, is where the body is directing you. And then the right spot, second of all, is with some more intelligent, intentional choices of picking certain areas of the body to work on, because there will be high payoff for these reasons of connecting to the arteries, or connecting to certain nerves, or connecting to certain venous plexus areas, things like that. So that's really my goal, is to allow people a way to evaluate, assess the body, one that takes into consideration the body's wisdom and guidance on where to start and what the sequence of treatment can be, but then also to see the bigger picture beyond the musculoskeletal system, beyond the biomechanics, that considers the organs and the vascular structures and the nervous system. Because when we can consider that, we can use the tools that we learned in a biomechanical standpoint, or a biomechanical model, and use them in this new model and actually make those tools even more effective. So anyways, that's a big thing. The other really profound thing that came out of this weekend, maybe not it hopefully will be profound to you. To me, I had already known this and I teach it, but it just highlights the importance of it, was about the pancreas. So the pancreas is a endocrine and exocrine organ. It's a gland, and it is in the upper abdominal area, sort of a little more on the left side of the body than the right, though it does cross the midline a little bit. And it's deep to the stomach, and it's deep to the small intestines, deep to the transverse colon. But the thing about the pancreas is it's a very soft organ. It's described to us in the classes as having almost like an oatmeal-like texture, and it doesn't like to be pressed. It doesn't like to be pressed and compressed. And so we actually don't even learn a ton of mobility techniques for the pancreas, because that is how sensitive it is to being touched. And so this is one of the reasons why when I'm instructing people how to use self-massage tools, like the Courgeous ball and the viscera from a self-massage tool, one, why it's so important to use a soft tool, but then also why I discourage prone work directly over the area of the pancreas, is because the pancreas hates that. And actually, you can injure the pancreas doing that. You can create a flare-up. You can affect the flow of the bile into the pancreas. You can affect the blood flow into the pancreas. You can affect the function of those cells, because it is such a soft organ. And so you want to avoid pressing on it as much as you can. And what was interesting in this class is, and this is part of the reason I love learning from Ron. Ron is a naturopathic physician, and not only is he a naturopathic physician, he's really well read on the research, and he constantly is learning and constantly is sort of like understanding how the function of the organs is affected by manual therapy. And so he just brings so much to the table when he's teaching from a practical application standpoint, and also a reminder of how powerful the work we do is. And one of the things he shared is recently they, meaning the scientists, discovered that I've talked about how mechanoreceptors of pressure, the pressure mechanoreceptors, are like kind of the love language to all the organs in the body, because that's how they know where they are in space, is because all the spaces they are in are pressurized. And so they know where they're at in this space and what's going on in the space based on how much pressure they're feeling. And when we think of the abdominal cavity, or any cavity for that matter, whether it's the cranial or like the neck or the thorax, the abdomen, or the pelvis, all of those containers, though we call them containers, which they are, we have to really remember that there's no extra space in those containers. The space is filled up with like with things. And so it's not like there's just like extra space to move around. There is just space, and some things take up more space than others. And when there's a lack of mobility, they don't all get along very well. But it is so important for the body to avoid compressing and putting extra pressure on the spleen, or sorry, not the spleen, the pancreas, that the pancreas actually has like a way higher amount of mechanoreceptors in it, specifically the pressure mechanoreceptors that are Pacini corpuscles. There is like a ridiculous amount, high concentration of these Pacini corpuscles in the pancreas, because it basically is like if the stomach's pushing on it too much, it sends a message to the brain of like, get the stomach out of here. Like it's constantly, the pancreas is constantly like, give me my space. Like give me as much space as possible so the rest of you fuckers don't touch me. So I thought that was just so interesting, because it just, again, like shows you the physiology and the structure of the organ. Like it reflects a lot about that organ, and then also informs our practice as manual therapists and as body workers and body movers of like what not to do and like what not to fuck up. And so I cannot stress enough to familiarize yourself with where the pancreas is and like not smash the shit out of it. Basically, it's behind the stomach, and not that, I don't know if this is helpful in my sweatshirt, but it goes from your spleen, which is in the sort of upper corner of your abdomen underneath the diaphragm here on the left side. That's the tail of it. It sort of connects over there. And then it comes across in an oblique fashion, so a little bit of a diagonal, comes this way. And the head of it sits in the beginning of our small intestine, which is the duodenum. So like it's this big tube C curve here. And it goes, it's a little bit more superficial at the head, and then it goes deeper at the back there. But it's always there. And so this whole area of our body, this left side here, we should really avoid doing a lot of smashing of as much as we can, because it is not protected by the thorax. It is in the abdomen, so it doesn't have a hard frame around it. And so we have to honor that and know that it's not going to probably feel good to press on it, right? Because instantly those pressure receptors are like, no, don't do this. And then also it can disrupt function. And pancreatic function is extremely important for our life. We don't fare well without a good, optimally functioning pancreas. So really important to honor that. And then the other thing I wanted to just share, that, I was kind of thinking about this podcast, like, what do I want to talk about? I don't necessarily have like a topic, and I know I always like want to share what's on my mind, and I definitely wanted to share my insights from this class and just a little bit about it. But I was also thinking about, other things that I could share and other things that are on my mind, and is a little bit about, so part of why this is on my mind is I actually asked Ron to be a guest on the podcast, because I'm like, I told him, I was like, I actually talk about you a lot on the podcast. I was like, so I was kind of like, if you're interested in it, like he's a busy guy and the guy probably has many better things to do than chat with me and be on the podcast. But I was like, if you're interested, I would love to have you on as a guest. I was like, because like instead of me talking about him all the time, why don't you guys just hear from him and hear what he has to say? But with that said, like he's such a wealth of knowledge, so I'm like, I gotta like pick a topic for us to sort of talk about for an hour, and just to give him expectations. Like he likes to be well prepared and stuff, so it's like to give him expectations of what we'll be talking about. And so I haven't decided yet, but one of the things I was thinking about is like he was a very integral, I think that's the right word, integral part of me learning this work and applying this work and seeing the power of this work. And part of the reason why is because when I was first learning, I took their listening techniques course, which is their course that helps you to get really good at trusting what you feel in your hand. And that is their assessment. Their assessment is always based on what you're feeling in your hand. And they would emphasize to us how important the assessment was, because that is what told us, how we listened to the body and how we were able to figure out where the body wanted to start, right? And you might have heard me talk about this before, because this is why I actually created the LTAP, is because this is hard. This feeling through your hand, these lines of tension, these directions from the body, it has a huge learning curve, and it also is like nothing that you've ever learned before in the world of manual therapy and like athletic training school or physical therapy school or massage therapy school even. And so because it has such a big learning curve and because it feels a little out there because it's not what we're used to learning, a lot of professionals, when they go through the program, they just don't do it. They just rely on the techniques, and then they might wonder, or maybe they don't, they might wonder why they don't get as good of results. And it's because they're skipping the assessment piece, and the assessment piece is the most important thing. But like a lot of people in their work at the beginning classes, I was struggling to trust what I feel in my hand and to really even know if I was feeling anything, to be honest. And he was teaching that listening techniques one class, and he came over during a lab session with me and was like, okay, tell me what you're feeling. And I was like, I'm not feeling anything. And he goes, okay, take your hand off of the patient. And I was like, okay. So I took my hand off, and he's like, whenever your hand is on someone, permission only to feel and not to think. Because when you're thinking, you miss actually what you're feeling. And this is a concept that I teach over and over again when I'm teaching in the LTAP level 1, when I'm teaching in the mentorship program, just when I mentor anyone, is like, even with my athletes, if they're thinking about how they're moving, they can't feel what's going on with their movement. And feeling's always going to be more powerful. It's a neurologically faster information to your brain than thinking. And so anyways, he was really who was like, feel, don't think. And whenever you find yourself thinking, take your hand off the patient and like restart. And that was like a point in learning that I really was like, okay, that's where the work was. And then that's when I realized actually too, it was impossible to feel in my hand if I wasn't very good at feeling my feelings or feeling other things happening in my body. And so I went down this whole path of really getting in touch with my feelings and practicing paying attention to how I felt with movements and like honoring that and just really emphasizing that in any sort of exercise or movement intervention or manual therapy I did. I really worked on paying attention to how things felt at the beginning, during, and after. And then also practicing whenever my hand was on a client to not be thinking. And so Then it took years of that practice to like really be able to trust what I'm feeling. And now I trust my hands and what they feel over anything. Um, Even the LTAP. I'd say like 99% of the time it lines up. But if I'm ever in a pickle where I'm like, oh, the LTAP's telling me this, but my hand's going this, I go with what my hand is feeling more than anything. So, so this is why I was thinking about feeling. But then the other thing that happened in class is both of the TAs would come up and tell me like how good my hands were and like how good my hand placement, my awareness of the anatomy, like the level of touch, like being able to like feel what, like they're like, man, like you're really good. And she was like, I just want to let you know that I noticed that. Like, and it was such a wonderful compliment because because this is a manual therapy class and to be told that you have good hands is like the best compliment ever. And it's something my patients tell me, like, I've heard that before. It's not like she's the first person to ever tell me I have good hands. But I appreciated it because she is one of the TAs that has really good hands. And so I'm like, man, if she's noticing it, like, that is a huge honor. And then I started thinking about it in terms of like what has made me like that and it's practice, repetition. It is practice of feeling all the things, of letting go of my ego, of like getting out of my thinking mind, all of it. And then it's also constant study of the anatomy. And actually, through teaching other professionals in the LTAP, I've gotten better because teaching forces you to know the material more. Teaching forces me to really understand not just the anatomy on paper and not to just be able to like speak about the anatomy, but it requires me to demonstrate my knowledge of the anatomy through touch and through like topology, right? Like palpation topology and palpation in general. And that's something that when I am teaching practitioners in the LTAP, like I'm huge on, is like it takes repetition and it takes palpating a lot of bodies and it takes studying the anatomy a lot to really get clear on what you're feeling. And also, you can't expect to have a good assessment experience or a good treatment experience if you don't take the time and go slowly to set yourself up in the right position to let the anatomy speak to you. And so, so I'm like, yeah, that makes sense that she's seeing the knowledge in my hands and like that dedication to learning and practicing and repeating and like, being patient and like making sure I'm on the spot and like not just diving in the technique because I've been actively practicing that. And then this thought process of like just having good hands and being good at working with the body in front of you, having a knowledge of the general anatomy, but then being able to find the anatomy on the body in front of you, got me talking to Susanna. And I was like, one of the things, so this is going to go two ways. So one of the partners that I've had in the past, that Susanna knows as well, she had said to me in one of the courses that my belly got in the way and that the techniques were uncomfortable when I was doing it on her because my belly was touching her, which I was like, we're supposed to contact, like use our whole body in a lot of these techniques, like, be like, like it's a sideline technique. So I'm sort of leaning on the patient's body, and like rounding their pelvis and their trunk with my arms. And then my hands are in a like very precise position, either in the organs or in the joints. And she had a real problem with my belly being on her. which is weird because I'm like, well, that's like part of my body. I'm like, I'm sorry. Like, I don't know how to not use my body in the technique and then have my belly approximated against you. And it stuck with me, obviously. Like, whenever anybody like says something's wrong with you because of your body shape or your body size or how your body is, it doesn't feel very good, no matter like how good of a body image and like self-confidence you have about yourself. Whenever anybody does that, it doesn't feel very good. As you can see, I'm getting a little teary-eyed, right? So that was interesting. And then, come to find out that they're like, oh, we don't, some people are like, oh, we don't like working on bodies like Anna's because it's harder to feel stuff. And this has actually come up in this actually is a question that comes as a teacher. This is a question that comes up a lot. Is someone will ask, and they mean well, and I'm not like talking down on anybody. If this was you in a class, is like, well, how are we supposed to use this technique in someone who's overweight or obese or, this can also be with like people with bodies that are like missing limbs or, has scoliosis or like just any sort of variation from society norm, right? People are like, well, how am I supposed to use this technique with this type of population? And it's like a question that drives me nuts. And what's wonderful about this question is actually the first ever continuing education course I took when I was a young new grad back in like 2004. I took a manual therapy class with a man named, I've talked about him before on this too, Pete Emerson in Denver. He's a high velocity manual therapist, and he was teaching a muscle energy course. He called it a manual activation procedure or something, muscle activation procedure. And we were assessing the SI joint, we were assessing the spine. The SI joint is very hard to palpate on every body, not just overweight and obese bodies, but it can be challenging on everyone. And somebody raised their hand and like, well, how am I supposed to do this on an overweight person? Like, it's pretty impossible. And he got fucking pissed at that question. He got so pissed. And this guy was like a very fit, like you could tell he was like strength training and exercise was like a big part of his life. And he got very upset at that person. And he was like, that is not their problem. That there's nothing wrong with their body. He's like, there's nothing wrong with their body. He's like, if you can't palpate them, it is nothing to do with them and everything to do with your level of skill and your ability to understand the anatomy and your ability to feel what you're feeling through your hand. He's like, that is not a them problem. That's a you problem. He's like, so you better figure it out, because that's your responsibility as the healthcare provider, not their problem as the patient. And, obviously the person that asked the question, because he was so firm with that answer, was like, oh, like embarrassed and felt ashamed, I'm sure. And like, could he have like said it nicer? Probably. But also, he's not wrong, right? Like, if you're having a hard time feeling the anatomy through layers of fat, it means that you're not very good at feeling in your hands, period. If you're having a hard time feeling the bones underneath the layers of fat, then you're having a hard time feeling in your hands. And it's up to you to get better at feeling and palpating different types of bodies. And it also means that you might have to pick a different position than you were taught the thing in school, right? Like, this is like a concept too. I'm always trying to like hammer home in some of the assessment tests we use in the LTAP is you are not bound to assessing patients in a supine position or prone position on the table. You can do seated, you can do standing, you can do side lying. The anatomy should not change in all of those positions. And sometimes with different body shapes or sizes or ability levels or like just whatever, right? Changing the position allows you to have better access to the anatomy you're trying to feel because it changes the tensions, right? Oftentimes in the abdominal, even my athletes, oftentimes they have so much tension in their abdomen from their tight abs and their stiff fascia that in the supine position, it's very difficult for me to palpate their organs. So I put them in seated or I put them in a sideline position, and then it decreases some of the tension I'm feeling. And then I can get in there and feel what I'm feeling. So I love this sort of like idea, like I said, that I first learned from early in my career. And I'm so grateful that I had that learning experience because never have I ever in my career been like, but I can't do this technique on this person's body because there's something wrong with their body. I've always honored that, like, if I can't figure it out, it's fucking my problem. Like, I need to do better. And that was just really, it's just been reiterated by my experiences in these manual therapy classes too. And also by like knowing which partners I have, which, I started this whole this podcast talking about like one of the reasons I chose to come to this class this weekend is because I had somebody in the class that I knew I could trust as a partner to, one, give me good feedback, also had good hands and was going to work good on me, and like is used to working with all different types of bodies and doesn't find a problem with it. In fact, like likes it because she knows it challenges her skill level, challenges her ability to get better. And so the whole like land the plane on it, right? Like the whole reason I'm bringing this up is because practicing feeling takes time. Our ability to feel through our hands and our fingers is scientifically proven to be like the tiniest thing. You can feel more than you think. You're just thinking too much and you're not practicing it enough and you're making excuses. And then also, if you are one of those providers that has maybe blamed the patient and their body size or their body shape or their body ability to not be able to do a certain assessment technique or a treatment technique or a exercise or whatever it may be, that's a you problem, not a them problem. And so there's nothing wrong with it being a you problem because when we identify our limitations, we have an ability to then make a choice to change it, to improve, and to change where our limits exist. So hopefully you found this podcast episode helpful, insightful, and have some thinking points to consider. I'm going to go now and enjoy the last few hours I have to explore Vancouver before I have to go back to the airport. Sadly, I was supposed to go whale watching today on the Salish Sea, and I was very excited about it. Even though it's kind of like the tail end of whale watching season here, I was just excited to be on the water in the Salish Sea because I haven't been on it before, and I love being on the water, and I love the Pacific Northwest. So I'm bummed it was canceled this morning because of the wind. And I'm looking outside and I'm like, it does not seem windy at all. But on the map, it was saying that like wind gusts up to 22 miles per hour. And I think it's the direction of the wind. And I've been on boat rides when it's windy and it's not fun. So I understand their need to cancel the trip, but I am super bummed nonetheless because whether or not I was going to see orcas and whether or not I was going to see humpbacks, I was looking forward to just boating on the Salish Sea. But I'll have to save it for another time. Good news is there's a lot of humpbacks in San Diego right now, and they're actively feeding on their migration. So hopefully, I'm going to text my friend and see if I can get on the boat this week in San Diego instead. So have a great week. We'll see you next time.